The material that may be required for circulation is a circulator, a saline bag, and an infusion line. Sometimes it is necessary to interrupt the treatment and go into circulation. This is how it is done without returning the blood. Stop the blood pump and press bypass. Clamp the arterial and venous line, disconnect them from the patient and connect them using a sterile circulator. Open the clamps on the bloodline and start the blood pump for circulation. Reduce the blood pump speed to local circulation speed. If circulating for longer than 5 minutes, it may be necessary to connect a saline bag to keep the pressure stable. Connect the primed infusion line to the arterial port below the arterial clamp on the Surdial X. Open the clamps on the port and the infusion line. To end circulation, stop the pump and close the clamps on the infusion line and the arterial port. Close the arterial and the venous clamp on the bloodline. Discard the circulator and connect the bloodlines to the patient. Open the clamps, turn off bypass and restart the blood pump. In units using saline bags with 2 lock connections, you may also connect the bloodlines to the bag directly. Stop the blood pump and press bypass. Clamp the arterial and venous line, disconnect them from the patient and connect them to the saline bag. After opening the clamps, reduce the pump speed according to local policy and start the blood pump. This is the procedure if the blood needs to be returned to the patient before circulation. For reinfusion, a saline bag is needed. Stop the blood pump and press bypass. Do not press reinfusion, as this will lead to the treatment end. If the full volume needs to be returned, clamp and disconnect the arterial line from the patient and connect it directly to the primed infusion line using a circulator. Alternatively, connect the primed infusion line to the arterial line below the arterial clamp on the Surdial X. Reduce the blood pump speed to local reinfusion speed. Close the arterial clamp, open the clamp on the infusion line and turn on the blood pump. Once enough blood has been returned to the patient, stop the blood pump. Now also clamp the venous bloodline and disconnect both bloodlines from the patient and connect them using a sterile circulator. Open the clamps and start the blood pump at local circulation speed. reconnect the patient, stop the blood pump and close the clamps on the arterial port and the infusion line. Close the clamps on the arterial and venous blood line, discard the circulator and connect the blood lines to the patient. Open the clamps on the arterial and venous blood line. Start the blood pump and deactivate the bypass button. Set the blood pump back to the desired pump speed.